Imagine feeling like your skin is constantly on fire, itching, or peeling, making you self-conscious and uncomfortable. You're not alone. Millions of people worldwide struggle with skin conditions that impact their daily lives, particularly psoriasis and rosacea. Each of these conditions causes redness and inflammation, but that's where the similarities end. So, what's the difference between them, and why does it matter? Stick with us as we break down these two common yet very different conditions, how they affect your body, and what you can do about them. What are psoriasis and rosacea? Let's start with psoriasis. This is an autoimmune condition, meaning your immune system mistakenly attacks your own body. Here, it causes your skin cells to multiply up to 10 times faster than normal. The result? Those cells build up on the surface of your skin, forming scaly, thick patches called plaques. This condition isn't just a cosmetic issue, it can be painful, itchy, and even impact your quality of life. Psoriasis affects over 8 million people in the US alone and often begins between ages 15 and 25. Then there's rosacea, which impacts about twice as many people in the US, over 16 million. Unlike psoriasis, which can affect any part of your body, rosacea mostly targets your face. It starts with frequent blushing or flushing, often leading to visible blood vessels, acne-like breakouts, and thickened skin over time. It usually hits later in life, often between ages 30 and 60, and can be just as frustrating as psoriasis. How are they different? So, if both conditions cause redness, inflammation, and discomfort, what's the big difference? While psoriasis is the result of an overactive immune system, rosacea is thought to stem from immune and neurovascular issues, essentially, problems with the way your blood vessels and immune system respond to certain triggers. Both conditions have triggers, but they differ, just like the treatments. Psoriasis symptoms can show up almost anywhere on your body. From your scalp to your soles, psoriasis can cause thick, red patches of skin with silvery scales cracked, dry skin that may bleed itchy, painful patches swollen, stiff joints if you develop psoriatic arthritis. Rosacea symptoms, on the other hand, rosacea stays closer to the face. Its main symptoms include persistent redness and facial flushing, swollen, bumpy skin, visible blood vessels, especially on the cheeks and nose, red, watery eyes, or eyelids that may swell. The science behind each condition. Psoriasis comes down to a fast-growing skin cycle. Normally, it takes about a month for new skin cells to travel to the surface and be shed. But with psoriasis, this process happens in just a few days. It's like your skin cells are on a treadmill set at maximum speed, causing them to pile up instead of shedding naturally. While scientists don't know exactly what triggers this rapid growth, they believe it's a combination of genetic and environmental factors, like infections, stress, or even certain medications. Rosacea, however, doesn't have such a clear-cut cause. Experts believe it could be a combination of immune system dysfunction and neurovascular issues. You're more likely to develop rosacea if it runs in your family, and certain triggers, like alcohol, spicy foods, or even hot beverages, can make it flare up. Types of psoriasis and rosacea. Both psoriasis and rosacea come in multiple forms, each with unique symptoms. Types of psoriasis. 1. Plaque psoriasis, the most common type, showing up as red, inflamed patches covered in silvery scales. 2. Guttate psoriasis, small, droplet-like spots, usually appearing after illnesses like strep throat. 3. Inverse psoriasis, red, shiny patches that form in body folds, like the armpits or groin. 4. Pustular psoriasis, inflamed skin with pus-filled blisters, often accompanied by fever and extreme itching. 5. Erythrodermic psoriasis, a rare, serious type causing a red, peeling rash over large areas, which can be life-threatening. Types of rosacea. 1. Erythrodermatic rosacea, redness and flushing, usually with visible blood vessels. 2. Papulopustular rosacea, acne-like breakouts on the face, along with redness and swelling. 3. Psoriasis rosacea, thickened, bumpy skin, particularly around the nose. 4. Ocular rosacea, Redness and irritation in the eyes, often accompanied by swollen eyelids. Common triggers. Living with either of these conditions means becoming a bit of a detective, as certain triggers can lead to flare-ups. Psoriasis triggers. Stress. An overload of stress hormones can exacerbate psoriasis. Infections. Illnesses like strep throat can trigger guttate psoriasis. Medications. Some drugs, like lithium, can make psoriasis worse. Rosacea triggers. Hot beverages and alcohol both increase blood flow to the skin, causing flushing. Spicy foods. Foods containing capsaicin, think chili peppers, can make rosacea flare up. Sun exposure. UV rays can worsen rosacea symptoms, so sunscreen is a must. Treatment options. Here's where it gets a little tricky. While both conditions have treatments, they don't overlap as much as you might hope. Treating psoriasis, topical treatments, corticosteroid creams can reduce inflammation, while vitamin D creams can slow down skin cell growth. Light therapy, exposing the skin to controlled doses of UV light can slow cell turnover. Biologics. These newer drugs target specific parts of the immune system to reduce symptoms and are often prescribed for severe cases. Treating rosacea, topical creams, brimonidine gel can reduce redness for up to 12 hours, while azelaic acid cream targets inflammation. Oral medications. Antibiotics like doxycycline may help control the acne-like symptoms of papulopustular rosacea. Laser therapy. This is especially helpful for reducing visible blood vessels. Lifestyle tips for managing both conditions. While you can't cure psoriasis or rosacea, certain lifestyle changes can help keep symptoms under control. 1. Avoid common triggers. This means watching your diet, managing stress, and avoiding skincare products that aren't designed for sensitive skin. 2. Stay cool. Heat can make rosacea worse, so try to keep your environment cool and avoid steam rooms and hot baths. 3. Use sunscreen. Sun exposure is a common trigger, particularly for rosacea. A broad-spectrum sunscreen with SPF 30 or higher is essential. 4. Stay moisturized. Keeping your skin hydrated can help ease some of the symptoms of both conditions, especially psoriasis. 5. Seek shade. When you're outdoors, wear a hat or stay in the shade to protect your skin from the sun. When to see a dermatologist. If you're dealing with symptoms of psoriasis or rosacea, or both, don't try to handle it alone. A dermatologist can help you find the best treatment plan tailored to your symptoms. Both conditions can affect more than just your skin, too. For example, up to 30% of people with psoriasis develop psoriatic arthritis, while those with rosacea may experience other health issues, like respiratory diseases or diabetes. Early treatment can help you manage symptoms and avoid complications down the road. Final thoughts. Living with psoriasis or rosacea can feel isolating, but you're not alone. Millions of others face similar challenges, and with the right treatment plan and lifestyle choices, you can reduce the impact these conditions have on your daily life. Remember, managing these conditions is a journey, not a sprint. Embrace the process, work closely with your dermatologist, and don't let your skin define you. With awareness, proactive care, and a strong support system, you can take control of your skin and regain confidence in your life.